Welcome to Healthy Living. I'm Lori Johnson. So glad you tuned in today. Our topic is mental health, particularly depression. And my guest is psychologist Dr. Sonam Hafiz. Dr. Hafiz, thank you so much for being here today. Great to see you.
Thank you for having me on your show.
So, in the years leading up to the pandemic, depression has been such an issue for so many people, but it really even intensified in 2020 and ever since then. What kind of numbers are we looking at regarding depression as it relates to the COVID-19 pandemic?
So depression was always a pretty big pandemic within the mental health community. But now with COVID-19 and the pandemic, the lockdown, this roller coaster that we're on, CDC estimates that we have about 1 out of 4 Americans with clinical depression, which is a pretty big number if you think about it. That's 25%, which is much higher than the number that was estimated previously. And it just seems to be going up. I mean, those of us in the mental health field feel that this is probably the next pandemic or a very closely following pandemic. But, we've got so many moving parts right now. It's hard to just focus on one particular thing.
Well, we've all struggled emotionally through the pandemic. It hasn't been easy for anyone. Our lives have been turned upside down, and just the not knowing that we never know what's going to happen from one day to the next. Just a couple months ago, it looked like the pandemic was over, and now here we are back again with the cases rising and so much concern about it. How does a person know whether they're actually depressed or just, having a tough time as we all are?
There are distinct differences between just having a tough time and being clinically depressed. So when you're clinically depressed, there are big changes that start to happen in your body. And initially, you might brush them off as just, oh, I'm overworked, or I had a bad meal, or, I had a stressful conversation with a parent or a friend or a relationship issue. But the reality is that in depression, what we notice a lot of is a big distinct shift in the way you sleep and the way you eat, in the pleasurable activities. So if you're withdrawing from people, you're not enjoying the things that you enjoyed previously. If you feel like you're, always in a mood, you are irritable, you've lost interest in, sex, you've lost interest in work, in seeing people, and just sort of feeling like yourself, those are pretty clear signs of depression. And depression just feels like a different shift in your body. You feel fatigued, you feel tired, even when you've had enough sleep. So those are some very clear signs that, you should look out for. And there are some differences between genders and races and the way people deal with it. But these are some of the more typical generic signs.
So who generally is being depressed? Are we seeing women depressed more than men, for example?
I don't know if the data is really out there yet, because like I said, there's so many moving parts and there's so much that needs to be studied about depression, especially in the context of COVID. But, we are seeing that, and this is more from clinical experience and doing a lot of interviews and being in the media, is you hear a lot of women struggling because they're juggling so much between children, homeschooling or remote learning, still running your home, still working from home, now starting to transition back into the workplace. And so there's a lot going on, I think, from the majority of moms, for instance. I think men are also at a great risk because unlike women, they don't have the same relationships or the same social support network. And they're also inclined to hunker down and pretend nothing is wrong. And so men have always been a pretty leading statistic in depression for this very reason. Men who take things hard but don't necessarily have the coping skills and are afraid to reach out or even accept that there's something wrong.
Well, you listed some of the symptoms of depression just a moment ago. How long do those need to go on before a person can say, I think I might be depressed? I mean, all of us have bad days, if a bad weekend or a bad week. I mean, how many days in a row does it need to get to the place where we're like, hey, I am depressed?
Generally, about 2 weeks is the cutoff, but 2 to 3 weeks, if you feel like the majority of your past month has been sort of this kind of dark, moody place. You're lashing out, you're irritable, you're not sleeping well, you're not eating well, you're just not feeling like yourself. It's probably time to at least explore that with a professional. You don't have to go as far as even a psychologist or psychiatrist. Start with your PCP, start with your pediatrician, start with the general health practitioner and have a conversation, have a candid conversation, and maybe they can make the referral.
So when you feel like this has been going on for at least a couple weeks, you should probably reach out to your doctor maybe first and say, I think I might be depressed. And then perhaps they can recommend some sort of a mental health professional that you could talk to. Is that what you're saying?
Very much so, yes. I mean, that's what the PCP is sort of like your first line of defense. They know you, they know your medical history, and they are probably the best source for a referral. And, there's one more thing that I want to make sure that the listeners, the viewers are aware of. This pandemic isn't the cause of depression. It has either exacerbated depression or it has revealed depression. The kind of depression that might come out of this pandemic could just be sort of feeling lonely and isolated, which is understandable. When we talk about depression, we're talking about an organic psychiatric disorder where there are the chemicals and neurotransmitters in your brain are involved. You probably have a family member who has suffered from depression because there is a familial genetic link. And it's likely that you always had some level of depression, maybe low-lying, low threshold, but it was mitigated or buffered by going to work, by seeing friends, by going out. And you didn't have to deal with it. You worked all day, you went out for a couple of drinks, or you went out to see friends, or you went to a movie, came home, fell asleep, did the same thing over again the next day.
A lot of people have some trepidation about seeing a mental health professional. So if your PCP, for example, recommends that you go to a psychologist, for example, what can a person expect?
I think if you see a psychologist or even a therapist, a social worker, a psychiatrist, I think it's fair to expect to have a candid conversation, an interview. When in my clinical practice, every now and then I'll encounter someone who says, but I don't want to talk about it. And, and it's not that a mental health professional might be pushy, but they need to talk about it. They need to understand your life so they can help you best. But you can expect a mental health professional to be patient and to be calm and to give you time to slowly, come around to having a frank conversation about what you're feeling, and that it is really a safe, ideally a judgment-free zone. There's confidentiality. A lot of people worry about others finding out. We in the mental health professionals, more than other health professionals, are sworn to a very high level or code of ethics, and there is no talking about it. If I ever run into a patient of mine in a grocery store, I don't say hi unless they come up to me.
Wow, that is very reassuring, especially for people who live in a small town where everybody knows each other, or is really, has a certain career and is very concerned about no one finding out that they might be depressed. Well, we're going to take a quick break and be right back with psychologist Dr. Sonam Hafiz. We're talking today about depression. Stay with us.
Life is better with a good night's sleep. Get your free DVD or booklet of Protect Your Sleep as the world watches from the outside.
It's a big diplomatic tug of war here in the Middle East.
Go inside the story with Jerusalem Dateline.
Israeli archaeologists are talking about a discovery that could change the thinking about the Temple Mount.
Join CBN Jerusalem Bureau Chief Chris Mitchell and get the biblical perspective on the events shaping the world.
What starts in Israel then ends up going to other places.
Watch Jerusalem Dateline Friday night at 8:30 on the CBN News Channel.
Life. It's meant to be lived fully. Jesus said it. I came to give you life, life to the fullest. Life in your family. Life in your finances. Life in your body, mind, and spirit. Life in your everyday. At CBN.com, we're taking what Jesus said seriously. We're here to help you discover life. Life. Live it fully. CBN.com.
Welcome back to Healthy Living. Today we are talking about depression with psychologist Dr. Sonam Hafiz. Dr. Hafiz, you did such a great job explaining the symptoms of depression and what to do initially. And when you reach out to a mental health professional such as yourself, you have that frank and honest and very private conversation about what's going on. Some people might have some reservations about seeing someone professionally because they think that automatically the person is going to put me on an antidepressant and I don't want any drugs that affect my mind. Can you speak to, how often and how prevalent antidepressants are and really what your opinion of them are? And also the different kinds of antidepressants. It seems like there are so many different kinds.
Yeah, so, antidepressants are an incredible tool. And even if it's not supposed to be long-term, to kind of centering the person or bringing them back to baseline, for instance. Most doctors should and will not jump to put you on antidepressants without at least some sort of an assessment. I'm a neuropsychologist, so my personal trademark is assessments and evaluations. And I believe in that because if you're not doing a thorough assessment, you don't really know what you're addressing, what you're treating. But there are other health professionals that maybe see far more patients than I do in a day and cannot do an extensive assessment or evaluation, but they will still do something along the lines of maybe a standardized scale, a series of questions, and they should, rely on more than one type of information. They should do an interview and ask you how different aspects of your life is being affected by depression. And if they decide to put you on medication, it should ideally also be accompanied by talk therapy, cognitive behavioral therapy, seeing a therapist, a psychologist, and making some actual tangible changes in your life, whether it's more meditation, more exercise, more yoga, anything to sort of, help you get through the day. And those who are really suffering from depression are likely to see a significant amount of relief almost right away. But there's one of the things that I think is really important to mention here is that the brain is a beautiful, wondrous, mysterious place even now. So what might work for you may not work for me because we have different body chemistries. We have different neurotransmitters, different imbalances, different genetic code that we all come with. And so to say, well, this medication worked great for my friend, but it's not doing anything for me, just means that it needs to be tweaked. Maybe the dosage needs to be tweaked. Maybe we need to try a different class of medication and see what works. The most common are like the SSRIs, where they work on the serotonin neurotransmitters in your brain. So things like Zoloft, Prozac are the most common ones that you hear about, but there are other medications as well. And a good doctor, a good physician will take everything into account and do your blood work before they put you on something, and then have you come back and give them an account of how well it's working.
I thought it was really interesting a moment ago when you said you would also take an inventory about the exercise, and it just kind of makes me wonder about these sort of behavioral pattern, lifestyle choices, things like that can make a difference in depression. We hear things about certain diets that can help. So in other words, diets that have a lot of sugar or a lot of the processed foods can actually affect you mentally, and that lower sugar and more whole foods are better for your mental health. Is there anything to that?
I mean, there's something to the effect of, the more wholesome your diet is, the more whole grains or good fats, and less processed sugar is good for you. while there is a slight benefit to it, we have to be very careful because there is so much misinformation out there where people think that diet can change the course of, let's say, mental health. It's basically saying the same as, positive thinking can cure cancer. You have to follow the science and you have to listen to your doctors. And while those things are an amazing amount of added benefit to a regime or an actual treatment plan, it by itself is absolutely not enough. If you're really suffering from depression, remember that it is a true psychiatric disorder. You need to see a physician for either, your PCP or a psychiatrist, and you need to ideally see a psychologist or at least a therapist that can get the ball rolling on both aspects of both fixing or trying to address the medical causes for depression, but also make long-term changes and try to help you figure out what's causing the depression and how you can make lifelong changes toward betterment.
Once you are on, say, for example, a prescription that seems appropriate, do things like diet and exercise and getting a good night's sleep and staying away from social media, all these things that they say are bad for your mental health, can these make your prescription work better, or can make your recovery even more substantial?
Oh, 100%, 100%. So now if you're already on an actual prescription of both medication and therapy, you're seeing someone and you're taking medication and, you have to give yourself a few weeks before you can start seeing results. I mean, I think sometimes people get discouraged because they think, well, I took this medication 2 days ago and I'm not feeling better. It's not that instant. It can take a few weeks before your body can adapt to the medication, before your mind can start healing from whatever is going on with you by, talk therapy and cognitive behavioral therapy. So, apart from that, the changes that you can make in your daily life, getting 7 to 8 hours worth of sleep, staying away from, toxic friends and social media or relationships that are hurting you, I think those things are critical. And, getting sunlight, for instance, vitamin D, lack of vitamin D has been known to contribute to depression. Now, that's not to say that if you don't get sunlight, that's the only reason you're depressed. But, those things can make a huge difference. Exercising, meditating, yoga, talking to a friend, talking to your mom, playing with a pet, playing with a baby, right? Like these things we know make you feel better. And if it can make for one good evening, but you do a lot of different things 3-4 times a week, those evenings start to add up, and then suddenly you start to feel a little better. So, there's no one stop shop for depression. There's no one single cure. You have to have, and then that's why this is tricky. I think we live in a culture of quick fixes and, pop a pill, and it's not that simple. Depression is a myriad of problems coming together. Chemically, emotionally, psychologically, childhood trauma. And now with COVID, loss of job, financial insecurity or instability, you might have lost someone to COVID. Also just sort of like, wow, we don't seem to be coming out of this. It can be very depressing. It can be debilitating for some folks. Most of us, decided, okay, you know what, well, there's a vaccine, there's an answer. And now we have to look at, the next wave of, the Delta variant. And it just seems to be an ongoing thing. So it's the self-care component of it, having frank conversations with yourself, with your healthcare provider, seeking help, talking to your loved ones is really more critical now than ever.
Well, we're going to take a quick break and be right back with psychologist Dr. Sonam Hafiz. We're talking today about depression. Stay with us.
Introducing the CBN Bible from CBN.com. Now, an easier way to study the Bible and grow in your faith. Highlight your favorite verse. Read separate versions at a glance. Click and read a commentary. Or cross-reference your favorite verse using the Strong's Concordance. All the right tools to study the Bible, all in one place. The CBN Bible, available at cbn.com/Bible or the iTunes App Store.
This is CBN Newswatch.
Thanks for joining us.
Watch breaking news, exclusive stories and programs, credible news reporting.
We show you what's happening in the world and how you can pray about it.
This is CBN News Watch, because truth matters. Weekdays at 5 on the CBN News Channel.
Woohoo! Hi, Superbook fans. Here's something else you'll love. It's the new Superbook Bible app. It's packed with games, activities, and Superbook episodes that you can watch for free. Oh, no! There's trivia, a fun daily devotional, and answers to your Bible questions. Plus, an easy-to-understand Bible the whole family will enjoy. You can even create your own Superbook character. Ta-da! Whoa!
Millsburg Falls man, come...
Sorry, pardon me. Sorry, excuse me. Ouch!
Are you getting this?
Earn super points to win daily prizes, too. And so much more! Time to get back to my adventures. See you soon. It's the new Superbook Bible app. Free downloads on iTunes, Google Play, and Amazon.
Welcome back, and continuing our discussion with psychologist Dr. Sonam Hafiz about depression. And you were mentioning, it's so important to get the right medication. How often is the dosage wrong right at first, or how often do medications not work and you might need to tweak it or need a different one or add an additional one?
I don't know exact numbers, and I'm always cautious about putting information out there that may not be current or accurate. But oftentimes, the first time you try something, you go back to the doctor and go, oh my God, I feel great. This was fantastic. But a lot of times people go back and go, but it caused weight gain, or I feel like my moods are a little bit more unstable, or, my appetite is gone. And you really have to discuss that with the prescribing doctor. They may titrate the dosage. They may decrease the dosage. They might try a completely different line of medication. They may add another medication, maybe let's say an anti-anxiety or another depression medication. So I feel like the communication needs to be open. You need to be having these candid conversations. And there's one thing that I'm a huge proponent of, and that is keeping some sort of a log, a diary. If you see your doctor every 3 weeks, you may not remember how you felt maybe 2 weeks ago. And so I tell my patients, to keep a simple log. It doesn't have to be complicated. If you have 5 minutes to write down something substantial, great. But we all know 5 minutes sounds like nothing. But in a day, you don't know where the 5 minutes go. I make so many resolutions every year of things that I'm going to do. And I can tell you that I don't do them. So I don't want to be a hypocrite and make it sound that it's easy. But one of the things that I say to my patients, I go, in your phone or in your diary, give yourself a number every day. 0 being, no depression symptoms, 10 being very depressed, or let's say 0 being very depressed and 10 being very happy. And give yourself a number, and you start to see a pattern emerge. Well, I've been in 2s and 3s for the last couple of days, but back then I was like 8 or 9 every day. And so it kind of starts, and then you start to say, well, what am I doing differently? Am I just taking my medication on time? Am I happier or doing better when I talk to my therapist or my psychologist? Am I doing better when I do breathing exercises or when I take a walk? Am I feeling better on days that are sunnier versus maybe cloudy or rainy? And you start to see a pattern emerge of your personal tendencies, but also the things in your environment that affect you. If you feel like, well, every time, I have to have this meeting with my boss, I'm a 2, or I'm really angry, or I'm really anxious or depressed. Well, then that's a trigger for you, and you have to figure it out. That doesn't mean you quit your job. That just means you figure out a way around it. Maybe you'll say, well, maybe can we do this meeting by Zoom? Can I write you an email and update you on what I've done all week? Or maybe you can bring someone else into the meeting. My point is that there are ways around it, and they don't have to be catastrophic, and you don't have to throw the baby out with the bathwater.
Right. Wow, what fantastic practical advice. We're going to take one final break and be right back. Don't go anywhere.
Come home to the sounds of Southern Gospel from CBN Radio. You'll enjoy a rich Southern blend of bluegrass, classic gospel, and Southern gospel favorites like the Gaithers, the Crab Family, and bluegrass sounds like Mountain Faith. So make yourself at home with the all-new CBN Southern Gospel. Now available at cbnradio.com.
It's about the competition.
I kind of put that pressure on myself, and I think people had expectations.
It's about overcoming.
We use this phrase all the time, keep chopping, keep practicing hard.
It's about going the distance.
You know, I think as a father, it's my job, to lead, just be the best husband and father I can be.
Watch Going the Distance with Sean Brown Saturday night at 7:30 on the CBN News Channel.
Life. It's meant to be lived fully. Jesus said it. I came to give you life. Life to the fullest. Life in your family. Life in your finances. Life in your body, mind, and spirit. Life in your everyday. At CBN.com, we're taking what Jesus said seriously. We're here to help you discover life. Life. Live it fully. CBN.com.
Stay connected with CBN News all day across our platforms.
And we're back now talking with psychologist Dr. Sonam Hafiz. Dr. Hafiz, unfortunately, we only have about a minute left, and we've just scratched the surface of this giant discussion about depression, and so many people are dealing with it. How can people find out more about you, and can you recommend some other good resources for people?
Yeah, absolutely. One of the things I'm a big fan of are support groups, 1-800 helplines. I think the government should be, hopefully be working toward providing more resources to the general public where people don't have to worry about money and insurance or even copays, which I hear is a big problem all the time. I mean, copays add up. I can be found at comprehendthemind.com, on Instagram at Dr. Sonam Hafiz, one word. And, national support hotline, especially for anyone feeling or experiencing or witnessing suicidal behavior, changes in behavior that don't seem okay. That's the one thing that we also didn't get to was the suicide risk that accompanies depression, which has also gone up during COVID. And it's a big concern. And it needs to be addressed very soon. I think there needs to be a public change in perspective and the stigma attached to depression. And we're seeing people like Naomi Osaka and Simone Biles coming out and making statements, which I'm hoping is opening the conversation for the rest of us common folks.
Well, thank you again, Dr. Hafiz, for being with us. Great to see you.
Thank you so much.
And thanks to you, viewers, for tuning in to this edition of Healthy Living. I'm Lori Johnson, and we'll see you again next time.